Hey everyone, and welcome back. Ready for another deep dive?
Definitely.
Awesome. Today we're focusing on nephrology and urology.
Ooh,
I know, right? We've got a presentation and a whole bunch of research articles.
sounds good.
Yeah, we're going to be looking at how the kidneys and urinary system work
Okay.
and what can go wrong with them.
Right.
And of course, all the important stuff you need to know to keep them healthy.
I think a lot of people don't realize how important the kidneys are,
Totally. I mean, most of us probably don't think about them too much.
but they do so much, filtering out waste, balancing electrolytes, regulating blood pressure.
Yeah, they even help to make red blood cells.
Seriously, they're like the ultimate multitaskers.
I like that. And speaking of filtering out impurities, one of the articles mentions Ezekiel 36.25.
hmm
It talks about being cleansed with clean water.
Yeah, it's a really nice way to think about it.
It is, right. It's
Yeah,
a beautiful metaphor for what the kidneys do.
exactly. They purify our blood.
And when doctors are trying to figure out if your kidneys are healthy or not, there are certain tests they'll run,
Yeah, for sure.
like BUN and creatinine.
Right, those measure waste products in the blood.
Yeah, exactly. And then there's the glomerular filtration rate.
Oh yeah, the GFR.
Everyone loves the GFR.
It basically tells us how efficiently the kidneys are working.
So if those numbers are high, that's like a red flag.
Yeah, pretty much. High BUN, creatinine, or a low GFR, those are all signs that something might be off.
And it's not just waste products they're looking at either.
Oh, definitely not.
Yeah.
Electrolyte levels, vitamin D, calcium,
Wow.
even your red blood cell count can give us clues about how your kidneys are doing.
It's incredible how much information you get from just blood and urine.
Right. It's amazing.
I know. I was reading about these things called urinary casts.
Mm-hmm.
They're these tiny tube-shaped particles in your urine.
Oh, yeah. Those can actually tell us about specific problems in the kidneys.
So cool. They're like these tiny little messengers.
Uh-huh. I like that. Little messengers from the kidneys.
All right, let's talk about UTIs, or urinary tract infections.
Right, right.
I was actually really surprised to learn this.
What's that?
UTIs are the most common type of infection that people get in hospitals.
Wow, I didn't know that.
I know, crazy, right? And apparently they can be tough to diagnose in older adults.
Oh, yeah, that's true. Sometimes the symptoms are different in older folks.
Yeah, which can make it tricky.
Definitely. So when we talk about UTIs, we're talking about things like urethritis, which
Mhm.
is an infection of the urethra.
Right, and then there's cystitis,
Yes, that's when the infection is in the bladder.
and then the more serious one, pyelonephritis.
Right, that's an infection of the kidneys themselves.
Oof, that sounds rough.
It can be pretty serious.
So what usually causes these infections?
Well, most of the time it's a bacteria called E. coli.
Oh yeah, E. coli, I've heard of that one.
But there are other bacteria that can cause UTIs too.
Okay, so it's not always E. coli.
Right. And certain things can increase your risk of getting a UTI.
Like what?
Well, being female, having diabetes, or using catheters.
Oh, I see. So what are some of the warning signs of a UTI?
If you have a burning sensation when you pee,
Ouch.
or if you feel like you need to go all the time,
Oh yeah.
and sometimes you might even see blood in your urine.
Okay, so those are all signs to look out for.
Definitely. And then doctors can do a urinalysis and urine culture to confirm the diagnosis.
So they can figure out exactly what's going on
Exactly.
and make sure they're prescribing the right antibiotics.
Yep. And luckily, most UTIs respond really well to antibiotics.
That's good to hear. But there's another condition that seems a lot more mysterious.
Oh, you mean interstitial cystitis?
Yeah, that's the one.
Or IC?
Or painful bladder syndrome.
Right. So many names for it.
It's a chronic bladder inflammation, but we don't actually know what causes it.
And it seems like it's more common in women.
It is.
It's kind of interesting, though, because some research suggests that it might be linked to an overactive immune system.
Oh, interesting.
Yeah, and there's this idea that mast cells might be involved. Those are the cells that release histamine.
Right. And that histamine can cause swelling and irritation in the bladder wall.
I see, so it's like an allergic reaction in the bladder?
That's kind of the idea, yeah. And the symptoms of IC can be really similar to a UTI,
Oh, that makes sense.
but the key difference is that with IC, there's no bacterial infection.
So how do they diagnose it?
That's the tricky part. It can be really tough to diagnose
Yeah, I am a
and even tougher to treat.
Well, there's no cure for IC, but there are ways to manage the symptoms. Some doctors prescribe tricyclic antidepressants
Okay.
or antihistamines like hydroxyzine.
To block the histamine?
Right. And there's also a medication specifically for IC called Elmaron.
Interesting. So are they trying to use antihistamines because they think it's an allergic type reaction?
Possibly. The thinking is that by blocking histamine, they can reduce the inflammation and pain.
That makes sense. There's even research looking at using the BCG vaccine for IC.
Seriously, the one they use for bladder cancer.
Yeah. It's still in the early stages, but it shows some promise.
Wow, that's really interesting.
It is, right? Okay, let's shift gears a little bit and talk about urinary incontinence.
Oh, yeah. That can be a really tough one for people.
It can. It can really affect someone's quality of life.
For sure. And it's important to remember that there are different types of incontinence.
Oh, okay.
You've got stress incontinence,
Mm-hmm.
which is often triggered by things like coughing or sneezing.
I've heard of that one.
Then there's urge incontinence,
Okay.
which is this sudden, uncontrollable urge to urinate.
And then overflow incontinence.
Right, which can happen when there's a blockage in the urinary tract.
So I'm guessing the causes and risk factors are different for each type.
Yeah, absolutely. So for stress incontinence, it's often related to weakened pelvic floor muscles,
Uh-huh.
which can happen after childbirth or menopause.
I see.
Urge incontinence can be linked to neurological conditions like Parkinson's disease
Really?
or multiple sclerosis,
Right.
or sometimes it just happens with aging.
And overflow incontinence, that's usually caused by something blocking the flow of urine.
Yeah, exactly. Things like an enlarged prostate or a narrowing of the urethra.
So how do doctors figure out what type of incontinence someone has?
Well, they'll usually start by ruling out other things like UTIs
Right.
and then try to figure out the root cause.
I bet the treatment varies depending on the type and how severe it is.
You're right. It can range from pelvic floor exercises to medications to even surgical procedures.
The research mentioned these things called artificial urinary sphincters.
Oh, yeah, those are pretty cool.
They sound pretty high-tech.
They are. Basically, it's a device that helps control urine flow when the natural sphincter isn't working properly.
How does it work?
Well, there's a cuff that goes around the urethra
Okay.
to control the flow of urine,
Uh-huh.
and then a pump that moves fluid in and out of the cuff,
I see.
and a balloon to store the fluid.
That is some serious engineering.
I know, right? It sounds like science fiction, but it can really make a difference for people struggling with incontinence.
That's amazing. Okay, well, let's move on to another painful condition. Kidney stone.
Ooh, yeah, those are no fun.
I was surprised to learn that they're more common in men and Caucasians,
That's true.
and they tend to come back.
Yeah, unfortunately, the recurrence rate is pretty high.
What causes them?
Well, it can vary.
That-
Things like diet, dehydration, certain medications can all play a role.
I see.
But the actual process of how they form is kind of fascinating.
Oh.
Yeah, so basically, certain substances in your urine become too concentrated,
Mhm.
and then they start to clump together.
Interesting. I've heard that there are different types of kidney stones.
That's right.
Is that true?
It is. The most common type are calcium stones,
Okay.
either calcium oxalate or calcium phosphate.
I see. And then are there others?
Yeah, you've also got struvite stones,
Okay.
which are often linked to UTIs,
Right.
and uric acid stones, which can be associated with gout.
And what about those staghorn calculi? Those sound scary.
Those are the ones that can fill the entire renal pelvis.
Yeah, those ones. They sound really painful.
They can be. And larger stones in general are less likely to pass on their own.
So size and location matter.
They do. Smaller stones have a better chance of passing naturally.
And when a kidney stone is passing, that's when you get that awful pain.
Right. It's called renal colic.
And it's super intense, right?
Yeah, it's like a sharp, cramping pain that can radiate from your back to your groin.
Ugh, that sounds awful.
It's not pleasant. And sometimes you might also have nausea, vomiting, and blood in your urine.
Oh, gosh. So how do doctors figure out if you have a kidney stone?
They can do a urinalysis,
Okay,
imaging studies like CT scans,
Huh.
and renal function tests.
got it. And then what about treatment?
Well, it really depends on the size and location of the stone.
Right.
If it's a small stone, they might just recommend watchful waiting.
So basically just wait and see if it passes on its own.
Exactly. They might also give you pain medication
Yeah, that makes sense.
or medications to help relax the muscles in your urinary tract.
Oh, so that the stone can pass more easily.
Yeah, exactly. But for larger stones, they might need to do a procedure,
Like what?
like shockwave lithotripsy.
What's that?
It uses sound waves to break up the stones.
Wow, that's so cool.
Or they might need to do surgery.
Oh, wow.
It really just depends on the situation.
Makes sense.
Yeah.
All right, let's switch gears to polycystic kidney disease, or PKD.
Okay.
This is when you get fluid-filled cysts in your kidneys.
Right, and it can really affect how well they function.
I know there are two main types.
Yep. Autosomal dominant PKD,
Yeah.
which usually develops in adulthood,
Right, right.
and autosomal recessive PKD,
Okay.
which is present from birth or early childhood.
So how does someone know if they have PKD? What are the signs?
Well, you might have pain,
Okay.
high blood pressure, blood in your urine, and frequent kidney infections.
Oh, wow.
And PKD can also increase the risk of aneurysms and other complications.
That's scary.
It can be serious.
So how do doctors diagnose it?
They often use imaging studies like CT scans or ultrasounds, and sometimes they do genetic testing as well.
Okay, so that's PKD. Now let's get microscopic and talk about the glomeruli.
All right. Those tiny filters in the kidneys.
Yes. The research mentions this group of conditions called glomerulonephritis and glomerular diseases.
Right, which basically means there's inflammation in those tiny filters.
And that inflammation can lead to two different syndromes.
Yep, nephritic syndrome and nephrotic syndrome.
Those are different, right? What are the key differences?
They are. Nephritic syndrome is usually characterized by blood in the urine,
Okay.
and it can make your urine look kind of cola-colored.
Whoa, really?
Yeah, and you might also have reduced urine output.
Oh, wow.
And then there's nephrotic syndrome,
Yeah.
which involves a lot of protein loss in the urine.
So that's the key difference, protein versus blood in the urine.
Exactly. And that protein loss can cause a bunch of other problems.
Like what?
It can lead to low blood protein levels. And then you get swelling, especially around the eyes, legs, and abdomen.
Oh, wow. So it affects the whole body.
It does. It can even mess with your thyroid hormone levels and increase your risk of blood clots and infections.
It's crazy how these tiny little filters can have such a huge impact.
I know, right? It's amazing how everything is connected.
So we've got nephritic syndrome and nephrotic syndrome.
Yeah.
Are there specific types of glomerulonephritis too?
Yeah, there are a bunch.
Oh, wow.
So there's post-infectious glomerulonephritis, or PIGN.
Okay, and that one's caused by an infection.
Exactly. Usually happens after a strep throat or impetigo infection.
I see.
And it's more common in children.
Got it.
And then there's IgA nephropathy.
Okay, what's that one?
It's also known as Berger's disease.
Right.
And it's actually the most common cause of glomerulonephritis worldwide.
Really?
Yeah. It's more common in men.
Huh, interesting.
It involves these IgA antibodies that deposit in the glomeruli.
Okay, and what causes it?
Well, it often starts after an upper respiratory or gastrointestinal infection.
So like a cold or the flu or a stomach bug.
Yeah, something like that.
And what are the symptoms?
You might have blood in your urine, protein in your urine, high blood pressure.
Okay, so similar to the other types.
Yeah, there can be some overlap in the symptoms.
Right, right. Okay, I think my brain is officially full of glomeruli information for now.
I hear you.
Let's move on to something a little broader.
Okay.
Acute kidney injury,
Oh,
or
yeah.
AKI for short.
I've heard that one before.
Yeah, it's basically a sudden decline in kidney function.
And what causes that?
So many things. But they're generally categorized as pre-renal, intrarenal, or post-renal.
Okay, I'm intrigued. Break it down for me.
All right, so pre-renal AKI is when there's a decrease in blood flow to the kidneys.
Okay, so the kidneys aren't getting enough blood.
Right, and that can be caused by dehydration, heart failure, things like that.
I see.
Then there's intrarenal AKI,
Yeah, okay.
which means there's damage to the kidneys themselves.
So like an infection or something.
Exactly. Infections, toxins, certain medications.
Right.
And then lastly, there's post-renal AKI.
Okay, what's that one?
That's when there's a blockage in the urinary tract.
Oh, so the urine can't get out properly.
Right. And that could be caused by an enlarged prostate or kidney stones, for example.
So how does AKI usually present? What are the symptoms?
Well, it can be kind of sneaky at first.
What do you mean?
Like you might just feel fatigued, confused, short of breath.
Oh, okay.
But in more severe cases, you can have seizures and even slip into a coma.
Wow, that escalated quickly.
I know, right? It can be really serious, so it's important to catch it early.
So how do they diagnose it?
They'll usually do blood tests.
Okay, to check those kidney values.
Exactly. BUN, creatinine, GFR,
Right.
and then imaging studies to see what's happening in the kidneys and urinary tract.
Makes sense.
And treatment really depends on the underlying cause.
Okay, so it could be a lot of different things.
Yeah, like if it's an infection, they'll give you antibiotic.
Right.
If it's a blockage, they might need to remove it surgically.
Okay.
And sometimes people with AKI need dialysis.
To help filter their blood.
Exactly.
We were talking about all these different types of acute kidney injury.
Yeah.
And one that caught my eye was acute tubular necrosis.
Ooh, ATN. What is that one?
So it's a type of AKI
Okay.
where there's damage to the cells lining those tiny tubes in your kidneys.
Tubules.
Yeah, the tubules. They're responsible for reabsorbing all those essential substances back into the bloodstream.
Right, right. So what causes that damage?
It can be from ischemia,
Ischemia.
which means there's a lack of blood flow to the kidneys.
Ah, okay.
Or it can be caused by nephrotoxic drugs.
Now for what?
Nephrotoxic drugs, basically medications that can harm the kidneys.
Oh, wow.
Some common culprits are certain antibiotics, the cholesterol-lowering drug atorvastatin,
Atorvastatin? Seriously?
yeah, and a chemotherapy drug called cisplatin.
Wow, atorvastatin is a really common drug. It's kind of scary to think that even everyday medications can have these kinds of effects on your kidneys.
I know, right? It really highlights the importance of talking to your doctor about all the medications you're taking, even over-the-counter ones.
Absolutely.
Oh.
So how do they figure out if someone has ATN?
Usually it's based on their symptoms,
Okay.
blood tests, and urinalysis.
And is there anything specific they're looking for in the urine?
Yeah, they often see these characteristic muddy brown casts.
Muddy brown casts. That sounds interesting.
It's definitely a unique finding.
So what's the treatment for ATN?
A lot of times it involves supportive care with IV fluids,
Okay.
stopping any medications that might be causing the problem,
Right. That makes sense.
and sometimes they need dialysis if their kidney function is really bad.
Okay. That makes sense. Now let's talk about chronic kidney disease, or CKD.
All right. This is when the kidneys gradually lose their ability to function over time.
Right. So it's a long-term thing.
It is, unfortunately, and it's a really big problem.
Yeah.
Yeah, it affects millions of people worldwide.
Wow. So what causes CKD?
The usual suspects: diabetes, high blood pressure, glomerular diseases.
Ah, those guys again. But a lot of people don't even realize they have CKD in the early stages, right?
You're right. It's often called a silent killer because the early symptoms can be so subtle.
So how does CKD usually progress?
Well, as it gets worse, you might start to feel fatigued, have swelling, lose your appetite,
Okay.
and your urination might change.
Shane, how?
You might need to pee more often, or you might have less urine output.
Interesting. So how do they figure out how bad someone's CKD is?
They use the glomerular filtration rate, or GFR.
Ah, the GFR. We meet again.
Right. That tells us how well the kidneys are filtering waste from the blood.
Right, right. I remember that. And I think we talked before about how CKD can lead to other problems, right?
Yes, absolutely. It's not just about the kidneys themselves, but the impact on the entire body.
What kinds of problems can it cause?
Well, you can develop anemia,
Oh.
which means you don't have enough red blood cells.
Right.
Your potassium levels can get too high, which is called hyperkalemia,
Okay.
and you're at a much higher risk for cardiovascular disease
Oh, wow.
and even bone problems.
Wow. So it really is a domino effect.
It is. So managing CKD is really important.
Well, how do they manage it?
A lot of it comes down to lifestyle changes.
Okay. Like what?
Things like controlling blood pressure and blood sugar levels, maintaining a healthy weight, eating a balanced diet that's low in sodium and protein, quitting smoking, and limiting alcohol.
So basically all the things you should be doing anyway for good health.
Exactly. But they're especially important for people with kidney issues.
That makes sense. What about medications?
Yeah, there are medications that can help manage specific conditions, like antibiotics for infections,
Right.
diuretics to reduce swelling, medications to control blood pressure and blood sugar levels.
And for more advanced cases, dialysis or a kidney transplant might be necessary.
That's right.
Those sound like pretty major interventions.
They are.
So dialysis, that's when they filter the blood for you when your kidneys can't do it anymore.
Right.
And a kidney transplant, well, that's pretty self-explanatory.
Yeah.
It's amazing how far medical science has come in treating kidney disease, though. I remember reading about all sorts of exciting new research and advancements in both dialysis technology and transplant medicine.
Absolutely. It's a field that's constantly evolving, which is really exciting for patients.
Okay, before we wrap up this first part of our deep dive, let's talk about a condition that primarily affects men. BPH.
Oh, yeah. Benign prostatic hyperplasia.
Right. Benign prostatic hyperplasia. What is that exactly?
Well, it's basically an enlargement of the prostate gland.
The prostate gland. Remind me where that is again?
It's located just below the bladder,
Okay.
and it surrounds the urethra.
Right, the tube that carries urine from the bladder out of the body.
Exactly. And as men get older, the prostate often gets bigger.
And what does that do?
Well, it can put pressure on the urethra, which makes it harder to pee.
Ah, that makes sense. So what are some of the symptoms of BPH?
A weak urine stream is one of the most common ones.
Okay.
You might also have difficulty starting and stopping urination.
Ah,
frequent urination, especially at night,
okay.
and a feeling like you haven't fully emptied your bladder.
That sounds really frustrating.
It can be. And if it gets really bad, BPH can lead to urinary retention,
Urinary retention.
which means you can't pee at all.
Oh, wow, that sounds serious.
It can be. That's why treatment is so important.
So what are the treatment options for BPH?
It really depends on how bad the symptoms are and the individual's overall health.
Okay.
Sometimes just making some lifestyle changes can help.
Like what?
Things like limiting how much you drink before bed
Okay.
and avoiding caffeine and alcohol.
Right, right. What about medications?
There are medications that can relax the muscles in the prostate and bladder, which can improve urine flow.
Okay.
And then for more severe cases, there are surgical options to remove or reduce the size of the prostate.
So that takes the pressure off the urethra.
Exactly.
Makes sense. Okay, let's move on to another urological condition, urinary stones.
Okay. These are basically hard deposits that can form anywhere in the urinary tract.
So in the kidneys, the bladder, anywhere in between.
Yep, anywhere along the way.
And I'm guessing they're similar to the kidney stones we talked about before.
They are. The most common types are calcium stones, struvite stones, and uric acid stones.
Same as kidney stones.
Mhm.
So how do you know if you have a urinary stone?
It really depends on where the stone is and how big it is. Stones in the kidneys can cause flank pain,
Yeah, okay.
and stones in the ureters, those are the tubes that connect the kidneys to the bladder.
Right, right.
Those can cause really bad pain that radiates from the flank down to the groin.
Ouch.
Yeah, and you might feel nauseous or vomit,
Oh,
and
gosh.
sometimes you might see blood in your urine, too.
So location is key.
It is. Stones in the bladder can cause you to pee more often,
Okay.
have pain when you pee, and maybe even blood in your urine.
And how do they treat urinary stones?
Again, it depends on the size and the location. Small stones sometimes pass on their own.
Hopefully.
Yeah, pain medication can help,
Right?
and sometimes they can give you medication to help the stone pass.
I see.
But bigger stones might need a procedure like shockwave lithotripsy.
Right. To break them up.
Exactly, or
Yeah.
even surgery to remove them.
Okay, well, we've covered a lot of ground today, but there's still so much more to learn.
Definitely.
We'll be back after a short break to continue our deep dive into the fascinating world of nephrology and urology.
Can't wait. It's amazing how connected everything is in the body, isn't it?
It really is. Like, take high blood pressure, for example.
Yeah,
I always thought that kidney problems could cause high blood pressure,
they can.
but it turns out it can also go the other way around.
Exactly. High blood pressure can actually damage your kidneys over time.
Whoa, really?
Yeah, it's kind of a vicious cycle.
That's crazy. So you can have high blood pressure, which then damages your kidneys,
Right.
which then makes the high blood pressure even worse.
It's a recipe for disaster.
And diabetes is another big risk factor for kidney disease.
It is. Over time, high blood sugar can damage those tiny blood vessels in the kidneys.
Making it harder for them to filter out waste products.
Exactly.
So if you have diabetes or high blood pressure, it's really important to manage those conditions.
Definitely. Not just for your overall health, but for your kidney health, too.
It's all connected.
It is. And speaking of connected, let's talk about PKD again.
Polycystic kidney disease,
Right. It's a genetic condition.
meaning it runs in families.
Exactly.
There are different types of PKD, though, right?
Yep, there are a couple of different types.
And each one has its own inheritance pattern,
Right, so with autosomal dominant PKD,
which is the most common type.
exactly. If one parent has the gene, there's a 50% chance that each of their kids will inherit it.
Wow, so it's a coin toss.
Pretty much.
Yeah.
And then with autosomal recessive PKD,
Which is less common.
right, both parents have to carry the gene for their child to be affected.
So if you have a family history of PKD, it's worth talking to your doctor about getting tested
Absolutely. The earlier you know, the better you can manage it.
and hopefully prevent those complications down the road.
Exactly. And there's always new research coming out, too.
Oh, yeah.
Yeah, like some studies have shown that certain medications might be able to slow down the growth of those cysts in the kidneys.
Really? Like what kinds of medications?
Well, one example is metformin.
Metformin. Isn't that a diabetes drug?
It is.
That's so interesting. It's like they're finding new uses for existing drugs all the time.
It's pretty amazing, isn't it?
It is. It seems like medical research is constantly pushing the boundaries and coming up with new ways to manage these complex conditions.
I know. It's a really exciting time to be in medicine.
You know, something we haven't talked about yet is the emotional and social impact of kidney disease.
Oh, yeah, that's a really important point.
I mean, it's not just about the physical symptoms, right?
Definitely not. It affects your whole life.
Your work, your relationships, your sense of
Mm.
self.
The fatigue, the pain, the changes in your body image.
It can really take a toll.
It can. And it's not uncommon for people with kidney disease to experience depression and anxiety.
It makes sense. I mean, it's a huge life change.
It is. And if you need dialysis or a kidney transplant, that adds a whole other layer of complexity.
It's a lot to deal with.
It is. So it's really important to have a good support system in place.
Yeah, whether it's family, friends, or even support groups.
Exactly. And don't be afraid to reach out for professional help if you're struggling emotionally.
Absolutely. Okay, let's shift gears a bit and talk about some of the diagnostic tools doctors use.
Right.
We've talked about blood tests, urine tests, imaging studies.
Yep.
But there's another test that can be really helpful in assessing kidney damage.
You mean a kidney biopsy?
That's the one.
Yeah.
So why do they do a biopsy? Can't they get all the information they need from blood and urine tests?
Well, those tests can tell us a lot about how the kidneys are functioning overall.
Yep.
But a biopsy actually lets us see the damage to the kidney tissue up close.
So it's like looking under a microscope.
Exactly.
Wow. So they can see the damage firsthand.
Yep. And it helps them figure out the cause of the problem.
And how bad the damage is.
Exactly. Which then helps them decide on the best treatment.
So it's about getting a really detailed picture.
Precisely.
And sometimes a biopsy is the only way to make a definitive diagnosis.
That's true. Like, for example, with glomerulonephritis.
Right.
A biopsy can help them identify the specific type of inflammation
Okay.
and then tailor the treatment accordingly.
That makes a lot of sense. Okay, let's talk about treatment options for kidney disease.
Right.
We've touched on this a little bit already, but I'd love to hear more.
Sure. So, as always, the best treatment depends on the specific condition,
Right.
how severe it is, and the individual's overall health.
Okay, so it's not one size fits all.
Not at all. But for a lot of kidney problems, lifestyle modifications are a big part of the management plan.
So the same things we talked about before, like diet and exercise.
Exactly. It's all about those healthy habits. Managing your blood pressure, keeping your blood sugar under control if you have diabetes, maintaining a healthy weight.
Right, right. It's all connected.
It is. And then, of course, there are medications that can help manage specific conditions.
Okay, like antibiotics for infections and stuff.
Exactly. Diuretics to get rid of extra fluid, meds to manage blood pressure and blood sugar.
And what about for people with more advanced kidney disease?
In those cases, dialysis or a kidney transplant might be necessary.
Those are pretty big deals.
They are. Dialysis is a procedure that filters the blood when the kidneys can't do their job properly anymore.
Right, right.
And a kidney transplant, well, that involves surgically replacing a diseased kidney with a healthy one from a donor.
It's pretty amazing what they can do these days, though.
It is. Both dialysis technology and transplant medicine have come such a long way.
It's really encouraging.
Definitely.
Okay, so we've covered a lot about nephrology. Now let's get back to urology and talk about bladder cancer.
Okay. Bladder cancer is a serious condition.
And it's one of the most common cancers.
It is, unfortunately.
And you know it's really scary.
What's that?
Smoking is the biggest risk factor.
Yeah, it accounts for about half of all cases.
Wow, that's a lot. So if you smoke, that's a huge reason to quit.
It really is. Other risk factors include exposure to certain industrial chemicals,
way.
chronic bladder infections, and a family history of bladder cancer.
So if you're at risk, it's really important to be aware of the symptoms.
Absolutely. So what should people be looking out for?
Well, the most common symptom is blood in the urine,
Okay.
which can be microscopic, or you might actually be able to see it.
Whoa.
Yeah. And you might also experience pain or burning during urination.
Oh, that doesn't sound good.
Not at all. And some people feel like they need to pee all the time.
Even when their bladder isn't full.
Exactly.
You know, those symptoms sound a lot like some of the other conditions we've talked about.
They do, right. So it's really important to see a doctor if you have any changes in your urination.
Absolutely. It's always better to be safe than sorry.
Exactly. Early detection is key for bladder cancer.
It is. So how is it diagnosed?
Well, they usually start with a urinalysis.
Okay.
Then they might do a cystoscopy.
A cystoscopy.
Yeah, that's where they use a scope to look inside the bladder.
Oh, I see.
And then if they see anything suspicious, they'll do a biopsy to confirm the diagnosis.
Makes sense.
So what are the treatment options for bladder cancer?
It depends on the stage and the grade of the cancer.
Okay, so how advanced it is?
Right. But the main treatments are surgery,
Yep.
radiation therapy,
Uh-huh.
chemotherapy.
And immunotherapy.
Exactly.
Wow, we've learned about so many conditions today.
I know, it's a lot to take in.
But there's some good news too, right?
Oh, absolutely. There have been so many incredible advancements in both nephrology and urology in recent years.
Like what?
Well, in nephrology, they're doing some really cool research with stem cells.
Oh, wow. Stem cells. I've heard about that.
They're trying to figure out how to use stem cells to actually regenerate kidney tissue.
Seriously, that would be incredible.
I know, right? Imagine a world where we could potentially cure kidney failure.
That would be a game changer. And what about urology? Any cool advancements there?
Tons. They're constantly coming up with new, minimally invasive surgical techniques
Okay.
using robotics and laser technology.
Wow, so high tech.
It is. And these advancements mean less invasive procedures for patients.
So faster recovery times.
Exactly.
It's amazing how technology is changing the face of medicine.
It is. It seems like every day there's something new and exciting happening.
It's all very encouraging. There's also a growing emphasis on personalized medicine, right?
Oh, absolutely. That's a huge area of focus right now, tailoring treatments to the individual patient.
Based on their genes and other factors.
Exactly, because we're all different and we all respond to treatments differently.
I love that idea. Personalized medicine is the future.
Hmm.
Okay, I think it's time to start wrapping things up.
Okay. Should we go over some of the key takeaways from today's deep dive?
Definitely. I think one of the biggest things we've learned is how important preventative care is.
Oh, yeah, that's a huge one.
So what are some practical things people can do to protect their kidneys?
Well, staying hydrated is key,
That's always good advice.
especially as we head into those warmer months. And managing your blood pressure, especially if you have hypertension.
Right, and if you have diabetes, make sure to keep your blood sugar levels under control.
Absolutely. Those are probably the biggest things you can do.
And be mindful of the medications you're taking.
Yes. Even over-the-counter meds can be hard on your kidneys.
It's a good reminder to always talk to your doctor or pharmacist about any potential side effects.
Exactly.
Of course, there are some things you can't control, like genetics.
That's true. But even if you have a family history of kidney disease, there are still things you can do to lower your risk.
Like living a healthy lifestyle.
And getting regular checkups.
Speaking of checkups, we talked about routine urinalysis.
Mhm.
There's been some back and forth about whether it's really necessary for everyone.
Right, some experts are saying that it might not be as effective as we once thought.
Especially for people who don't have any symptoms or risk factors.
Yeah, so it's definitely something to discuss with your doctor.
Figure out what's right for you.
Exactly.
So it's all about finding that balance between being proactive and not overdoing it on the tests.
It is.
Before we move on, I just want to circle back to the emotional and social side of kidney disease one more time.
Oh, for sure. That's so important.
It can be really tough to deal with, both physically and emotionally.
It can. The fatigue, the pain, the dietary restrictions, the constant medical care.
It's a lot.
It is. And for people on dialysis, the time commitment and the lifestyle changes can be really challenging.
It's so important to have a strong support system in place.
Absolutely. Family, friends, support groups, therapists.
They can all make a huge difference.
They can. Don't be afraid to reach out for help if you need it.
Exactly. There are people who care and resources available to help you through it.
That's right. You're not alone in this.
It's amazing how these systems work,
It really is.
The kidneys are small, but they do so much.
They're like these tiny little powerhouses.
Right. They're always filtering, reabsorbing, making sure everything's balanced.
It's incredible. And when you think about how much blood they process every day,
It's mind-blowing.
it is. It really makes you realize how important it is to take care of them.
Exactly. So what are some things people can do to keep their kidneys healthy?
Well, first and foremost, stay hydrated.
Always good advice.
Drinking plenty of water helps flush out waste products and can even prevent kidney stones.
Right. That's good to know, especially as the weather gets warmer.
Absolutely. Another big one is managing your blood pressure.
Right. If you have hypertension, that's something you need to stay on top of.
It is. High blood pressure can really damage the kidneys over time.
And, of course, if you have diabetes, you need to keep your blood sugar under control.
Definitely. High blood sugar can also damage the kidneys.
It's all connected.
It is. And it's not just about what we eat and drink.
What do you mean?
Even some medications can be hard on the kidneys.
Oh, right. Like those over-the-counter pain relievers.
Exactly. If you're taking those regularly, it's a good idea to talk to your doctor.
Make sure they're not putting extra stress on your kidneys.
Right. Especially if you already have any kidney problems.
Of course, some things are out of our control, like our genes.
That's true. But even if you have a family history of kidney disease, you can still do things to minimize your risk.
Like living a healthy lifestyle and getting regular checkups.
Exactly. Speaking of checkups,
Yeah.
we were talking before about routine urinalysis.
Right.
And there's been some debate about whether it's really necessary for everyone.
Yeah, I remember reading about that,
Some experts are saying it might not be as beneficial as we used to think.
especially for people without any symptoms or risk factors.
Exactly. So it's a good idea to talk to your doctor about it.
See if it's right for you.
Exactly. It's all about finding that balance.
Right. Being proactive, but not going overboard with testing.
Okay, before we wrap up this deep dive, I want to touch on something again.
What's that?
The emotional and social impact of kidney disease.
Oh, yeah. That's so important.
It is. These conditions can really affect every aspect of your life.
Your work, your relationships, your sense of self-worth.
Exactly. And it can be really overwhelming.
It can. The fatigue, the pain, the dietary restrictions, the constant doctor's appointments.
It's a lot to handle. And then for people on dialysis, there are all the lifestyle changes and the time commitment.
It's definitely a life-changing experience.
It is. So it's really important to have a good support system.
Family, friends, support groups, therapists.
Anyone who can offer encouragement and understanding.
Absolutely. And remember, you're not alone in this.
There are so many resources available, and there are people who care.
Well, we've covered a lot of ground today.
We have.
It's been fascinating to delve into the world of nephrology and urology.
It really has.
And I think the biggest takeaway for me is the importance of being proactive about your health.
Absolutely.
Educate yourself, ask your doctor questions, and don't be afraid to advocate for yourself.
Couldn't agree more.
Well, we hope this deep dive has given you a better understanding of these amazing systems.
And inspired you to take charge of your kidney health.
Thanks for joining us on this journey.
It's been a pleasure.
And until next time, stay curious, stay informed, and stay well.